So we do any comprehensive musculoskeletal care that someone may need. And that certainly goes from anything from very simple, workups and diagnosis to physical therapy services, advanced imaging services, injection therapies, and then certainly a full array of surgical services as well.
Many things we do don't need surgery and can be treated conservatively with therapy, sometimes bracing, occasional injections or medications, trying to get people back to work or back to sport or whatever it may be as quickly as possible.
Even a problem that's surgical doesn't necessarily need to be managed with surgery. There's a lot of non-operative treatments that could be utilized in order to make that patient feel better, and that's what it's all about. It's about quality of life, what's right for that particular individual, and getting them back to the life that they want to live. That doesn't always mean surgery.
Every decision we should make on what's in the best interest of the patient. To me, that's patient-centered. Most of the problems we have, there's not just one treatment, right? There's several options. And you try and figure out what the best option is for that person and that problem. When I see them back in the office in a week or 2 weeks and they come in, I want people to do well. I want people to come in smiling, tell me how good they feel. There's nothing better than that.
The majority of orthopedic problems are non-surgical for quite a long time, and so that's why you want to have an experienced orthopedic doctor to diagnose the issue and figure out what's really causing the problem so that you can address it. But most issues can be treated initially with what we call conservative management. That would be non-surgical management.
That's a common misconception among patients is they think, oh my gosh, I'm seeing a surgeon, that means I need surgery. We use surgery as a tool, and it's typically the option that we offer after the conservative options have been exhausted. And so our goal is to get people better in the most efficient way that we can. Oftentimes that's with conservative things that don't involve surgery, but unfortunately sometimes that doesn't always work, and that's where we want to be able to provide surgical solutions to give a lasting result.
Most of our surgeries are outpatient, or at least what we like to consider as a same-day recovery process, right? It's still a process of recovery. It's still physical therapy participation after surgery, but really gone are the days of multiple days in the hospital, doing therapy in the hospital, to eventually a potential nursing home discharge before they eventually go home.
Back in 2011, 2012, we came up with the idea of developing an outpatient center specifically dedicated to outpatient joint replacement. What we found was that the patients were happier. They were more mobile, they were more independent, and they were reaching their therapy goals even faster. And they were becoming independent patients much, much sooner.
We can do full hip replacements, full knee replacements, partial knee replacements. All that can be done in a surgery center. The satisfaction is 98%. Across the board for our outpatients. 90% of my patients are going home within 4 to 5 hours of surgery. And so we are doing your surgery, we're getting you up, we're getting you moving, getting back to life again.